Hi, my name's Millie, and this talk is about a study that's just started data collection that's looking into how adolescents experience and regulate positive emotion and how this is reflected in the brain. So positive emotion is typically measured through the symptom anhedonia, which is defined as the significantly reduced ability to enjoy things that you would usually be able to enjoy. It's seen in most common mental health disorders, being most prominent in major depressive disorder, or MDD. Now, adolescent experiences of anhedonia are particularly important as they're associated with factors such as greater severity of depression and even increased risk of suicide. And interestingly, anhedonia is known to be roughly twice as common in adolescents with a diagnosis of depression compared to adults with the same diagnosis. Now, despite this, anhedonia is typically overlooked in existing treatments, with most treatments typically focusing on trying to reduce experiences of negative emotions rather than trying to increase experiences of positive ones. So one reason for this arguably misplaced therapeutic focus may be the lack of mechanistically informed treatments. Now, previous research has shown that experiences of anhedonia are associated with differential functioning of the brain reward network. Now, this is just the part of the brain that processes everything to do with rewarding or positive stimuli. But what we don't know is whether adolescents can use emotion regulation strategies, such as those that could be used in treatments, to modify their experiences of positive affect, and whether this will be reflected in a change on a neural level. So my research is going to investigate the specific emotion regulation strategy, savoring the moment, which is simply the act of focusing on your current experiences, reviewing them with kindness in a way that allows you to fully appreciate the experience. And these images here give you some examples of things that people feel are quite easy to savor. Now, previous research has shown that savoring works to both intensify and lengthen self-reported experiences of positive emotions. But what we don't know is whether adolescents can use this strategy to change their responses on both a self-report and a neural level. So I'm going to ask adolescent participants to come in and complete an emotion regulation task whilst having an fMRI scan. And then I'll also ask participants to complete questionnaires both on the day of the scan and then again 6 months later. So this is an example of what the task will look like. Participants will be asked to either savor or just look at a series of images before giving a behavioural rating of how positive or negative the image made them feel. So I'm hypothesizing that we'll see increased activation in the ventral striatum whilst participants are savouring compared to just looking at the images. And then that we'll see less discrimination in this neural activation between these two conditions in those with elevated levels of anhedonia. And so then I'll assess these through a series of whole brain and region of interest analyses that will all control for age and gender. So whether the results agree with my findings or not, this research will help to improve our understanding of this high-risk symptom and how it works on a neural level during the pivotal period of adolescence. This understanding can then be used to help to guide the development of mechanistically informed anhedonia-specific interventions, which will hopefully ultimately be used to help improve adolescent experiences of mental health. That's all from me. Thank you for listening.